Imbruvica, revolutionizing blood cancer treatment. A breakthrough drug for blood cancer patients, Imbruvica targets cancer cells and disrupts their growth. Learn more about this revolutionary medication. Mechanism of action. Targeted therapy. Imbruvica blocks a protein that cancer cells need to multiply by targeting cancer cell DNA. Apoptosis. Imbruvica increases programmed cell death, which causes the cancerous cells to die naturally. Immune system boost. Imbruvica enhances the immune system, allowing it to fight cancerous cells more effectively. Indications and usage. Mantle cell lymphoma. Approved to treat ML in adults after prior treatment has failed. Chronic lymphocytic leukemia. Approved to treat CLL in adults with or without other medications, depending on the patient's medical history. Waldenström's. Macroglobulinemia. Approved to treat WM in adults who have tried at least one prior therapy. Marginal zone lymphoma. Approved to treat MSL in adult patients who require systemic therapy and have received at least one prior anti-CD20 based therapy. Efficacy and safety. Successful trials. Imbruvica has been associated with an overall response rate of 91% in clinical trials, and 81% of patients with CLL experienced significant shrinkage of their tumors. Adverse effects. The most common adverse events include diarrhea, nausea, vomiting, and fatigue. However, the majority of side effects are mild to moderate in severity. Long-term management. Patients taking Imbruvica are monitored regularly to ensure its safety and effectiveness over time, and studies have shown that patients can remain on treatment for several years with good outcomes. Dosage and administration. Oral medication. Imbruvica is taken orally, usually once a day, depending on the patient's condition and medical history. Individualized dosage. The dose of Imbruvica is adjusted based on the patient's age, weight, medical history, and other factors. Physician instructions. Patients must follow their doctor's instructions carefully for the best results and to minimize the risk of adverse effects. Adverse reactions. Common. Diarrhea, nausea, fatigue, vomiting. Less common. Hypertension, bleeding, skin rash, serious infections, kidney and liver toxicity, severe bleeding, tumor lysis syndrome, heart rhythm abnormalities. Conclusion and future of Imbruvica. Improved quality of life. Imbruvica has brought hope and increased life expectancy for many cancer patients. Investing in research. Pharmaceutical companies and researchers are studying Imbruvica's potential to treat other diseases such as lupus, arthritis, and Alzheimer's disease. Partnering with patients. Pharmaceutical companies and healthcare providers are partnering with patients and advocacy groups to support research and provide access to affordable treatment.